Here are 2 good points to remember. If a joint doesn't move enough, then we have to help it to move. If that joint moves too much, then we have to make it more stable by strengthening. But above all else, every patient deserves good education. For this video, I just wanted to talk about general shoulder pain. Shoulder pain that didn't happen from some kind of trauma where you might have fallen onto it or ran into a wall or caught something in an awkward way. I get a lot of that. Just general shoulder pain. Maybe you did some chores that you haven't done in a while overhead. Maybe the season's changed and you decided to get outside and garden a little more, or paint, again, overhead. Things like that. Now, what I find is that shoulder pain is directly related to your posture. Most people, we live in a forward bent lifestyle. You do everything in front of you. How often do you reach behind you? Not too often. And so those muscles on the back side, they tend to get weak and overpowered by the strong muscles on the front. So what you see is, instead of a good posture, as you see me slouching a little in this video anyway, most people's shoulders begin to come forward because of muscle tightness and muscle imbalance. What we need to do is get that balance back. We need to get you limber. We need to get you strong. Chances are you're not as young as you once were, so your body's, not as versatile. So what we find is that with your shoulder forward, you're forcing your shoulder blade forward, and I'll turn sideways for this. Now, your arm can't go all the way up without the shoulder blade moving out of the way. So you see, it doesn't matter how strong I am, that doesn't feel very good. But if you get your shoulder blades out of the way, then you can have full motion. Of course, I have sufficient muscle strength and muscle range of motion so that I can get that motion. And that's what we're going to try to get back for you here to come. A big thing about this is the rotator cuff. The rotator cuff's job is to pull the arm bone down away from where the shoulder bone and collarbone connect. Because if not, you get impingement or, pinching. And I like to say, if you've ever had someone poke you enough times in one spot, it begins to hurt. Well, think about right underneath these bones here. If you raise that up enough times and your shoulder blade doesn't get out of the way, then it's potentially poking that musculature and that connective tissue that crosses there. And after a while, your body's going to tell you it doesn't like that. Fun fact, the shoulder blade has 17 different muscles that connect to it. That's a lot. What happens is they're small and they're weak, so they get easily overpowered by this big pec muscle, and that's why your shoulders usually get pulled forward, especially because we use that big pec muscle all the time, and seldom do we use the muscles of the back. Now, am I going to give you an exercise for each of those muscles? No. There's some gross motor exercises that you can do to get those muscles adequate and sufficient in your needs. Now, how's our plan going to go? It's going to go just like any physical therapist plans their care for a patient. It's going to start with pain, then we're going to move to edema if you have any, swelling, range of motion, strength, proprioception, lastly, function. Now, most of those kind of overlap, so we're going to do a little bit of all of that, but hopefully by the end you'll be a well-structured machine. One of my favorite statements to tell patients is motion is lotion. Humans were made to move. We weren't made to sit in office jobs and cars, sit around and watch TV and the like. We were made to move. And when we stop moving, then our body doesn't operate the way it was supposed to. So again, we just want to get you back to moving. Motion is lotion. It doesn't matter if you follow my exercise programs or not. As long as you move, you should start to feel better. There are 2 different kinds of range of motion. There's normal range of motion, which as we get older, everyone tends to never be able to ascertain. For this video, we needed to define functional shoulder range of motion. So I found a couple of different articles. This one, for instance, defines functional shoulder range of motion for daily living activities. Activities that are defined in a few different questionnaires, as you can see in the introduction. And we'll kind of run through those so you know what activities they're talking about. So the first one here is the American Shoulder and Elbow Surgeon questionnaire, if you will. It basically asks, what is your pain today? Rate your function from 0 to 3. 0 is unable to do. 3 is without any difficulty. It asks you to put on your coat, sleep on the painful side, reach the upper part of your back, manage toileting, comb your hair, reach a high shelf, raise 10 pounds above your head, throw a ball overhead, do usual work, do usual sport. So next we have the simple shoulder test, which coincidentally says similar stuff. Lastly is the pin shoulder score. And so basically you can see all of these are similar in nature, okay? And then it goes on to ask more questions, and basically you get scored and they make a percentage of function of what your shoulder would be. That being said, if you wanted to know how reliable they are. So what did they find? They found that the average shoulder motion required to do 10 functional tasks was forward raising the arm 121 degrees plus or minus 6.7 degrees, backward raising the arm 46 degrees plus or minus 5.3, sideward raising the arm like a jumping jack 128 degrees or more, cross body adduction, so trying to reach for the opposite shoulder at least 116 degrees, external rotation with the elbow at the height of your shoulder to the side at least 59 degrees, and internal rotation with the arm at the side 102 degrees. Now, I always want you to go through no pain or mild discomfort at most so that you can give your body a chance to adapt to what we're asking it to adapt to. And then once you've adapted, you can begin to progress yourself forward and forward until you're kind of back to the functional position you want to be. All right, without further ado, here is level 1 for the shoulder. So what we find, core is going to be your biggest thing. Since we sit so much, we never contract a deep core muscle that stabilizes the shoulder blades. So how do you contract that muscle? Well, it's just like sucking your belly button in to put on some tight pants. Now here's the kicker. If you just did it as I was saying, you probably held your breath. When humans haven't done an action in a while or their brain needs a little help, it tends to cut off breathing for whatever reason. Now that being said, the next definition is most crucial. A core exercise is defined as any movement of 2 or more joints. For instance, you have your shoulder, your elbow, your wrist. You go to raise your arm. That's more than 2 joints. It's a core exercise. But you need to engage your core first. So I don't want you to suck your belly button in 100%. You just need to engage it. About a 25% suck in is all you need. And you need to do this with all that you can remember. Getting in and out of a car or a bed, doing chores, going to stand, going to sit, taking stairs, walking, exercising, anything you can remember, the more the better. Next we have a chin tuck. Chin tuck is relatively easy, you think, but many people do it wrong because they have a wrong recruitment. What I would like you to do is just give yourself a double chin. Take your head straight back on your neck. Now, 2 things that you might find yourself doing. 1, perform a nod, like nodding yes, or 2, opening your mouth. Now, when that happens, there are other muscles that are compensating. We don't want that. We just want motion to the upper neck, mid-back area, so that we get some muscles that are smaller to start moving again. Next, very, very important as well, we got to get your shoulder blades to move. If your shoulder blades can't move, then your arm's not going to be able to move. So I need you to squeeze your shoulder blades down and back. And only go to a mild discomfort. Never do I want you to push into pain. So if you can only squeeze 25% of the motion, that's fine for now. And just build off that over time. This is considered the mid-back core. So I want you to engage this before you do anything. Any kind of overhead arm elevation, lifting, so on and so forth. Now here's the hard part. I should say Simon Says first. Simon says contract your belly by squeezing your belly button in 25%. Now squeeze your shoulder blades together and perform a chin tuck. Now how hard is that? It's pretty hard, but you have to train at it. You have to get better at it, just like anything. Next, submaximal isometrics. So you're not using full strength here. The top picture, the gentleman is trying to raise his arm against the wall. The wall is stopping him, so now you're having a muscle contraction without the movement, which is usually a gentle way to kind of get the muscle a little stronger. And then in the top right picture there, he is actually squeezing the towel roll, which works on what we call shoulder adduction. On the bottom pictures there, you see that he is trying to rotate his wrist out into the wall. He's not by any means trying to hurt himself, okay? So just submaximal, whatever resistance feels pretty good. Hold for 5 seconds, repeat 10 times, do a couple times a day. On the bottom right picture, it's just the opposite. Instead of him pushing his wrist out, he's on the inside of the door and he is pulling his wrist in. Now obviously again the wall is stopping him, so there isn't going to be any motion. That's where isometric comes from. Iso means balance, metric means length. There's no length, just a small contraction. That being said, before you do these motions, I want you to contract your core. Belly button sucked in 25%. Shoulder blades squeezed down and back, about 50% or so. And then, of course, a little chin tuck. Now, we spend our whole life forward bent, so we need to stretch out of that forward bent position. So you want to lie over a tightly rolled up towel. Now, here's the problem. If you do a whole towel and you haven't done this in a long time, you probably hate me tomorrow. It's happened before. I've had patients quit therapy because I started them on too thick of a towel roll. And so, like Rafiki says, if you don't learn from the past, you run from it. So instead, I would like you to start with half of a full roll and then progress as you can tolerate. You're going to lay over this towel at 3 places: your lower, middle, and upper breastplate. Now, how long are you going to lay there for? As long as it feels comfortable. Once it starts to hurt, get up and get around, and then just time yourself and add a little bit of time every day. Lastly, the pec stretch in the corner. I've had people that can't find a corner, so just send me an email if you need a different variation of this stretch, because I'll be happy to send you one. Now, in this one, you just want to put your elbows up. She has them at shoulder height. Now, if that hurts your shoulders, drop them below shoulder height. And then all you're going to do is step in with one leg and use your leg to distribute the weight forward to cause a front stretch right in front of your armpits, where that big pec muscle, who's usually tight, pulling your shoulders forward, is getting stretched. That being said, you should switch legs, because anytime the leg that's forward, you actually get more of a stretch to that leg's side. So for instance, in the picture, her right leg is forward, so she is getting more of a right arm stretch. So just do both. What's good for the goose is good for the gander, okay? And then here's a little thing about posture. Now, good posture is definitely not what I'm doing right now, but it's what's natural because of how society has molded me. That being said, good posture is belly button is tucked in 25%. Shoulder blades are squeezed back, not 100%, but you go from 100% and you come off halfway. Next, you do a full chin tuck. Hopefully you have that motion. And then you come off halfway. Now that is your functional posture. It's where you should be. So there always comes a time when the patient asks the money question. How often should I do this? And how long before I see results? Well, the hard thing about that is it's going to take time. I always like to say Rome wasn't built in a day, but it was surely destroyed in one. So you'll have to do a little bit of this every day, and consistency is going to be key. I always say if you stretch consistently day in, day out, it'll take about 2 to 4 weeks, somewhere in that range, to start to limber up pretty good at rest. Strength takes far longer. For the muscles themselves to grow and get bigger takes a long time. We're looking at between 8 and more weeks. But what you'll find, and the reason why I'm going to tier these home exercise programs, is that just over the next few days, you're going to feel stronger. You're going to get motion back in your shoulders. You're going to be able to move a little bit more. You're going to feel a little bit better. And why is that? Is that because the muscle's gotten bigger? No, it's because the brain's adapted to what we've asked it to do. And it does this short term. It fixes your problems really quickly. It maps out what you want it to do and is very efficient to get it done. Neural adaptation can go anywhere between 8 and 20 weeks. So more exercise you do, the better. And that's the same thing I'm going to tell you here in a minute, is consistency is key, okay? If you want to be an expert at something, if you want to be a master at something, then you have to do that something repeatedly. Think about your job. If you've done it for a long time, then you probably could do it with your eyes closed. You probably could do it in your sleep. So just give yourself a chance, okay? Try. Please understand that consistency is the best thing that you can be. If you wanted to learn how to be a pianist, then you'd have to practice playing the piano. If you wanted to learn how to write calligraphy, you'd have to practice calligraphy, and so on and so forth. So the same thing for your own health is that you have to exercise, you have to move. Motion is lotion. There's no pill that a man can make that can give you a true fix. It's all just a mask. So it comes upon you and your responsibility to just take the first step. Just do something. Motion is lotion.